The two-day free health campaign at the Essoh Integrated Health Center has ended on a successful note with over 500 patients receiving medical attention. The campaign, which began on Friday, March 27, concluded on Saturday, March 28, 2026, drawing a massive turnout from Essoh and neighboring communities. Day 2 recorded high influx of patients as residents continue to benefit from free consultation, laboratory tests, eye care medications, and referrals. The response reflects the urgent healthcare needs of the population, noting that the majority of those attended to had not seen a doctor in years. The campaign was handled by a team of about 28 medical personnel, including doctors, nurses, laboratory technicians, and pharmacy attendants, who worked under tight conditions to meet the high demand. The exercise also attracted key administrative and traditional authorities. The Fawn of Essoh visited the health center, where he toured the facility and greeted patients and encouraged both the medical team and volunteers. The senior divisional officer for LABLM, the mayor of Menji Council, and other dignitaries visited to support the initiative. During the campaign, a 1-year-old was ill and was successfully stabilized, avoiding a referral outside the area, an outcome that showed the importance of the outreach. The mother and other beneficiaries, visibly moved by the gesture, expressed deep appreciation for the free services and called for such interventions.
My name na my Marie. Attah una plenty for good work wey una don do am for me. I remember say if una not for be, I not for know wetin I for do with this pikin now. But now they don't give treatment. I don't see the pikin dey get change, e dey fine. The pikin don start dey change, e dey fine, and then the way with the vomit, the vomit again plenty so. So I want to thank una, say thank una plenty for the good work wey una don do. And make God give una more, una can continue the help with for the good work wey una get am for. Thank una plenty.
More there, one thing so. Ndị akwa ile ọbụ dọkịta ọmụfụ ndị ọka ikide bụ otu metem. Ena leg glory and you fat. Ntena infant so ka for hospital wo. Ale jobu nduo mebo nyo. But ibu be nye doctor bo fa America fu. Mbo mo family men za bi bo nza. Be se mo nkuta wo. Ale for ka se mo to a mo na to bo na konta. Mi na sin konta ndam amoti mi na fi mo bo so ta. Mbo konta se ka bo no. Bo fonten so be temetem. Me fo if we sort out to make a million for. It won't come a level up, go by the four bear, Nankuta war. What's the monk that we sort out 20 hospital over here sent our war. Who's the monk contact sent us moon to all who wants to. Most in contact won't come for America. It won't come send so one color the who all. Bullet for one and Kuta wouldn't them, but fools in the foot arm and then them. We won't know for a hospital and we'll find them. Moon and contact as west now, who wants to live up. Won't contact, it won't come sent it out. It won't kill the animal, but we won't sort out to them. Both the moon to we will contain the level to we will move manage here with power. We will not get more crew for, but the milk level because the field of Dossi for in Kitawu. But Doctor not found duo, and my soldier left or known to a law. Bone and contact or time to make them. Belly be a them. Then, sir, it's a baby go into all you. Better to all manner of forbear. Name in your marriage or Bon Conte, Galagio will continue better. Bon and Conte, Bon Conte, and one other for the song.
The Chief Executive Officer of the Essoh Development Association, Attah USA, described the campaign as a major success, highlighting both the turnout and the impact. He noted that patients came from across the area and surrounding villages and expressed satisfaction that many who had gone years without seeing a doctor were able to receive care, particularly free medications.
The turnout was massive. Uh, we saw more than 220 patients, and they came from various parts of Essoh and also the neighboring villages and frontdoms. We had people from Fortabong 3, Njongo, Beta Funky, Lekong, Nje, Sangwe, Densa. So we're so happy that we could serve everybody.
He further revealed that the association will sponsor follow-up treatment for critical cases, including at least 3 surgeries, while patients requiring continued care, such as those on antibiotics, will be monitored at the health center for up to 3 months. Plans are also underway for a medical doctor to return and carry out minor surgery procedures.
More than 60% of the people have not seen a doctor and they were so happy, especially receiving free medications from the team. And we also uh, let them know that, especially those who have things to follow up, that we will be able to follow up and pay for. We had like 3 surgeries that will be done, and Agda USA will pay for that fully. We have decided that this will be a yearly event, and we will continue to support the different health centers in the through a partnership with the different with the health personnel in the health centers. Dr. Yami will be coming. He is currently in Fondumeter, and he will be coming to perform some of the surgeries, and we'll be in contact with them. And the other thing is that Center Chief uh, Pascaline, she has a track record. We have a few patients that had like 1 week of antibiotics that they have to be coming back to the clinic to receive these antibiotics injections. So we will be tracking them, especially through the personnel that are at the different at the health center. We will follow up for up to 3 months. Our hope is that the administration will also be able to help equip the health center that some of these can be done there. But as we get more resources, we will always be ready to do more for the health center.
Despite the success, organizers acknowledge challenges, including limited medication equipment and space, but assure that future editions will be better prepared.
We had a very short time to prepare for this campaign, and that was the first reason. And we were not able to get, for example, the eye specialist came in at the last minute, so we're not able to get enough materials and secure enough medications for the patients. Also, we didn't have enough reagents in the lab, but the next campaign will be in February next year, and we will be able to secure enough. And talking about the eye, we had 25 glasses that were donated. They were all used, but we promised the patients that within 2 weeks we'll be able to secure them with glasses.
The chief of Center for the Essoh Integrated Health Center, speaking as host, expressed gratitude to the organizers.
Madam Lieutenant Pascaline, the Chief of Center for Essoh Integrated Health Center. I want to give special thanks to Attah USA for this wonderful initiative. At least so far for the 2 days, we have about 500 and more patients, and we are really planning that they should keep on with the activity. So far, the community is very happy because so many used to be sick. They don't have money to come to the hospital. With this free treatment, they are satisfied. So we are also begging that they should at least send us doctor because we don't have personnel. Also, we are begging that they should send up equipment because we have limited equipment. We used to refer patients because we don't have equipment.
Health personnel who participated in the exercise expressed satisfaction at being part of the initiative despite the challenges of handling a large number of patients within a short period.
My name is Mr. Fonge Elvis, the chief of laboratory for this campaign. Yes, we came here for this campaign, and it's a very pleasure. It's a great pleasure for me for us to be here to try to see how we can alleviate some medical conditions for this our community. Um, we have some challenges. Some few have some much health aspects here like the H. pylori, which is seen around here, is a very common bacteria that is very disturbing people. But as doing our screening, we are trying to see how we can solve it. Of course, I'm satisfied with the campaign because the turnover is going there. As far as the laboratory is contributing to provide information, with, information for health district. It's a good thing.
I'm calling Claude Asaba, medical doctor, and volunteer for the 2026 health campaign, which in summary I can say was a success.
I'm Mr. Sona Joseph, a specialist in ophthalmology. Okay, as I said earlier, I previously worked in the center, so I came back to help my people. Concerning the work, since yesterday, I've been having so many patients. And normally it should be like that because all the patients over 40 years, they need the near vision. So this point of, at this area where people can read their Bible, they need it to read their Bible. It means that so many people have been carrying reading verses. For the organizing team, next time they should think of ophthalmology. They should think of ophthalmology in such a way they should be a good team that will come on the spot to help people.
My name is Danny Maxwell. I'm all the way from Campbell. I work with the Campbell Regional Hospital Annex. So we have been here for this our second day of the health campaign. Everything's been moving on well. At the level of the lab, I think everything is moving on well smoothly. Though with some challenges, the challenge that we face at the level of the lab is it looks as if everything at the level of the lab was not well organized because we have some sensitive lab tests that are lacking. So I would love to say that next when they do such a program, they should include a lab technician so that when he should give his own contribution as far as the issues of the lab are concerned because a lot is lacking in the lab. Notwithstanding, we are putting in our best and to see that things move on smoothly. So the program is a good one. We thank the sponsor for their support to the community, and we believe with this shall go a long way.
Volunteers also shared their excitement about contributing to their community after years away, expressing hope to return for future missions.
I'm Amikem Prudencia, a volunteer nurse from Yaoundé. And it's coming back to my people, giving them hope, discussing with them, hearing their problems and helping them. It's really grateful for me and it brings me too much joy. And I look forward for other programs like this so that I will come and meet them to continue from where we will end today.
Duna Doria from Chan. I'm actually here for the campaign. So far, so good. That was very nice because the road too were so favorable. Luckily, too, there was no rain. My arrival here has been good so far, so good. I've met my relatives and my friends, my father. So I'm still excited. The campaign has been so effective. People are happy too, and I'm also happy.
Miss Alemsio Alicia, I'm from Goya, and I'm the daughter of Essoh. I came here for the health campaign. When I heard about the health campaign, I was so excited. Having been trained as a nurse, to give my own expertise to my community was an amazing opportunity for me. So far, I'm so grateful how our people back in the village are eager to know about their health condition and how they want to treat themselves or get to know more about their health. So far, with the health campaign, it has been amazing and people are going home satisfied. So the Elder USA has done a great deal for us and for our community. Giving back to the community is great and the experience is marvelous. Everybody going home satisfied and we love it. Another opportunity is coming up for me to come here again and again. I will be here and I will not miss. Serving my community is one of my priorities and my
Partners supporting the campaign, including contributors from Boston, commended the initiative and encouraged sustained efforts to improve healthcare delivery in the community.
I am Chief Onkancha from Boston. I came here to represent the diaspora branch for the health campaign here at the Sota Health Center during the Degesa Festival. So far, I arrived yesterday. The turnout has been massive and not something that we expected. This is very encouraging, and I hope many people will see the videos and the pictures. But the turnout has been incredibly encouraging for us, for me personally, to be here, to see this, to see the kind of care that our people need, and to see how we can continue to gather resources to support our people, because health is key to everything. If our people are healthy, everything else will be okay. So far, health campaign has been a big success, and my message to my people is that we should not renege our efforts to support these kind of initiatives, to continue to empower our people with good health, and make sure that they don't lack what they need.
The Fon of Attah also praised the initiative, expressing hope that it will be sustained in the years ahead.
I just want to say that I'm very, very delighted and having language to express myself. First of all, to thank Attah USA for this wonderful activity to organize during the daily activities of South Dakota demonstrations. And the health campaign is very, very important because it has brought in not only people from South Dakota, we have neighboring condoms for them like the bank, Attah, Jumbo, Jogi, Patawan 3, Levier, Attah, and all the surrounding condoms and villages. So I'm particularly very, very delighted. And I wish that next year the same activities should be organized.
As the campaign concludes, it leaves behind not just treated patients, but renewed hope for improved access to healthcare in Essoh and its surrounding communities. For Gasa Media, I am Safe Mary.